Good morning. My name is Reggie Kaye, and I am here today to introduce to you my guest, Dr. Max Ronis. Good morning, Dr. Ronis.
Good morning. How are you?
Good, thank you. We are here to discuss a little bit about your career in medicine. You've been a physician for over 50 years, and you have been a noted ENT physician, ear, nose, and throat doctor, and a beloved professor of otorhinolaryngology to thousands of medical students, fellows, interns, and residents. So we want to talk to you today a little bit about your career and your thoughts on the future of patient care and medicine. Before we go on, can you please tell us what otorhinolaryngology is?
In the vernacular, it's ear, nose, and throat.
Okay.
That's pretty much what it is.
That's a long word.
That's why we call ourselves ear, nose, and throat doctors.
Understood. Since you've had such a long-standing career in Philadelphia, can you tell us a little bit about your career in Philadelphia? Where did it start? And what was your affiliation with Temple University?
Well, I went to medical school at Temple University, graduated in, I guess it's not a secret, 1956, and took my internship and resident training at Temple, finished in 1960. I had some beloved professors, one of which was Dr. David Myers. The other was my father, who was also an otolaryngologist. In 1967 or 68, I was happily appointed chairman of the department, and it was my earnest desire to not just practice ear, nose, and throat, but to be, I think, a clinician teacher and researcher, because those are the three arms that every department has to have. And I've been happily, since then, applying that triad of exercises. I'm the most grateful and happy person you can imagine, because I've had a pleasant and wonderful career, and I met thousands of young medical students that have taken, the ENT courses at Temple, some of which chose ear, nose, and throat as their career. We've trained, I think, close to 100, ear, nose, and throat doctors, and I imagine influenced a few others to have an interest, at least, in ear, nose, and throat. We've had an active research program at Temple for a number of years, and I was lucky enough to be able to fundraise enough to finance those research activities, both by private donations and by government grants.
What were those research programs?
Well, they're mostly surfaced about ear pathology and ear physiology or function. Tinnitus was always an interest of mine, and the causes of and the cure for tinnitus is still an interest of mine. The physiology of hearing, the central auditory pathway, there were lots of things that we did that were just interesting and stimulating and made it anything but a job.
How much did Temple do in terms of reaching out to the community, in terms of educating the community about hearing problems?
Well, the department at Temple, at least our department, had an office facility that took all comers regardless of the ability to pay, which was, I think, that Dr. Russell Conwell's admonition. And he's the one who started Temple University, and his axiom was acres of diamond in your own backyard, and we tried to be, that diamond for the people in the community. They benefited from our services, and we benefited from the fact that we were able to teach medical students and residents about their pathologies.
Well, they were certainly lucky.
So it was a even match.
They were very lucky to have you, and I'm certain that despite the fact that there were about 100 ENT doctors, there were other professional people who chose other careers who also benefited from learning about ENT.
Well, there were the audiology groups from the undergraduate school. The hearing science groups also rotated through our programs.
I see.
And as did the nursing students.
Okay. How have you seen the practice of medicine change over your career, in particular in Philadelphia?
Well, there are a lot more doctors than there used to be. I think that medicine is still a royal endeavor. And I think that people who go into medicine now, as well as people then, I do believe, have an interest in people, because it is a people game primarily.
Absolutely.
And they have a desire to do good and to help. There's always the financial aspects that come to the fore, but in truth, most of us are not MDs, money doctors. We're interested mostly in applying our trade and helping people. And as a secondary gain, we are able to provide for our families and ourselves.
Right. It seems like everything is so fast-paced in this world, including the area of medicine. It doesn't seem like you can sit with your physician and just talk for a couple of minutes before you even come in with your complaints. Seems like that's the case.
There is the need for some efficiency in terms of seeing patients. They have to see a certain number of patients per unit time in order to be a reasonable program. Number two, I think that medicine hasn't changed remarkably, except that with the new era, doctors have become much more data entry specialists than they are physicians laying on the hands, which is what you were alluding to. It takes most physicians many, many hours more than it used to, merely to input the medications, physical findings, etc., that are mandated now, so that a lot of us rail against that. I'm hoping that at some point somebody will look at all the information and use it.
So technology has definitely played a role in the field of medicine.
I don't think there's any substitute for knowledge and experience, but technology has enhanced our abilities to care for the patient.
Do you think with technology our doctors are better prepared for the practice of medicine in 2015 than they were decades ago when you first started?
I think that the pace of learning has increased because the amount of information has increased. The emphasis has changed a little bit in terms of what physicians should know. For example, when I was a medical student, we learned every nook and cranny on every single bone in the body and knew what the origin and insertion of every little muscle and tendon was. Well, I don't think that's necessary at this point, and people learn the anatomy that is important to their particular area of interest. So there's some streamlining, and I think also core material is still presented as the most important stuff that you need, and I think they do a good job. I think at Temple they produce wonderful clinicians, and my own daughter went to Temple and now practices in California at Stanford, and she says that her training and knowledge base compared more than favorably with their people there.
Wow.
Interestingly.
That's an interesting thing to say. What have been the highlights of your medical career? I'm sure there have been many, many, many. Can you just give us a couple?
Well, I think the mere fact of teaching was really the thing that I enjoyed most. And having, young physicians come and I've been able to impart to them some of the, I call them tricks. They're not really tricks, they're techniques, if you wish. And my approach to the patient, and hopefully they walk away with the same knowledge base and enthusiasm that I have. I think that's really the most fun.
Well, I'm certain that you were able to exude your personality upon these other students and teach them what made you so successful as a physician. What are your secrets for staying so young and dedicated to your patients?
Luck. No, I think it's the luck of the draw. My gene pool is reasonable, and I think that if you're lucky and don't try to do anything but live in moderation, you're going to be okay.
How long was your father an ENT?
My father was an ENT guy for about 35 to 40 years. He died when he was 80.
Wow.
And I'm significantly older than that now.
Can you give us some hope for the future of medicine and healthcare in this country? And what do you think is the next step in perhaps making healthcare delivery system in this country even better than it is? We're very lucky to be in this country, but what could improve it?
Well, there's no doubt that cost factors play a role in how patients access medicine. And I'm a great believer that there has to be a mechanism to allow most people to get to a physician and get the care that they need, period. Now, if that is a one-payer system, that's fine. I mean, there are lots of ways to do that, and there are, I guess, bits and pieces of number of systems that you can put together and create an entity that would care for people. But I do think that most physicians are willing to play whatever game is necessary in order to make that happen for their patients.
Is the insurance companies, the whole business of insurance, as much of a problem as it is for the general consumer?
Well, I'm not sure the insurance companies are a problem. They have a product, whether it's life insurance or automobile insurance or what have you. It costs some money, and they, in essence, try to dissipate those monies in a broad base and decrease their risk by having well people as well as not so well people, which is what happened with Obamacare. I think that the insurance companies are profit-making, obviously, but so are most things in this country and in this world. And I don't think that they are profit-making to the point where they would injure patients knowingly.
Mm-hmm. Okay. Well, Dr. Ronis, I want to thank you so much for your time. You're a very, very busy man. Thanking you for giving us your experience and your knowledge and your thoughts about healthcare in this country. And we wish you more years of continued success in the delivery of otolaryngology to all of your patients. Thank you.
I'll take it. Thank you.
Thank you.